Okay. Hi, everyone. Welcome to the Network for Public Health Law webinar, Food Insecurity and Food Safety, Policy and Legislative Actions. Thank you for joining us today. I'm Catherine Schutz, and I'll be your moderator for today's session. Before we dive into the content, let's go over today's learning objectives. So the objectives today are to obtain an overview of the food freedom trend in the United States, which goes by many names, including cottage food laws, food sovereignty, micro-enterprise kitchens, and food freedom. We'll also learn about the various food freedom policies that have been adopted and hear about state legislation likely to be introduced in 2025. Finally, we'll obtain insight into existing legal and policy levers that can both reduce food waste and address food insecurity, including incentivizing food donation and diverting edible food from landfills to dining room tables and homeless shelters. I want to let you know that the presenter's slides, along with a recording of this webinar, will be available on the network's website in about a week. And once they're posted, you'll receive an email notification with a link to access them, as well as a link to our post-webinar survey, which we'd greatly appreciate if you could take a few minutes and fill out that survey after the session. During the webinar, please use the Q&A function to submit any questions you have, and I'll do my best to address as many as possible at the end of the session. And with that, I'll pass it off to our first speaker, Doug Farquhar, Director of Government Affairs with the National Environmental Health Association. Thank you and enjoy the webinar.
Thank you, Catherine. I appreciate the time. I want to put a thank you out there also to the network for inviting me to come speak. I've been looking at this issue for a good 20 years now. One of the things we really need to highlight when it comes to food freedom is it's a recent issue that has moved forward. It's not something that has been around for a long time. It really, honestly, I have to say, came from the fact of the spread of farmers markets. And as we started getting more and more farmers markets across the country, we started getting more and more people selling directly, farmers and others selling directly to consumers without any regulatory oversight. And that has just led to an inherent problem. So it did start expanding about saying, well, do we really need to have these regulations? Or more honestly, for a small producer, small manufacturer, somebody who's making cupcakes, pies, making salsas and trying to resell them. Is this something that they are able to really are able to pay the fees that are necessary, go through the training, have a kitchen that is able to meet the requirements of a manufacturing facility, or are there other ways that came forward? So state legislatures across the country have really kind of gravitated towards this to say, yeah, we need to have some exemptions out there. We need to make it easier. And those freedoms, those permissive laws have grown every year, have become more substantial every year. Now, what I mean by food freedom, and I want to kind of clarify this, is I'm talking about cottage food laws, talking about raw milk laws, micro enterprise kitchens, food sovereignty, which is a term that's used in Maine. Every state has some sort of law that exempts retail foods from regulatory oversight. So this is not something you can simply say are in certain states. It is something that is really across the board. But we got to remember that we are seeing over 53,000 hospitalizations annually, according to CDC, from foodborne outbreaks. These numbers have increased substantially since the beginning of these food freedom laws. So it is having a impact on food safety. Next slide, please. Now, when it comes to food safety, honestly, the states and the locals are the primary regulators of food safety. The federal government, via FDA and USDA, provide the food code. They provide direction and guidance on what should be done out there. But it's really up to the states, all 50 states, to adopt the food code and the food code has been adopted by every state with the and it depends on which version that they've adopted. Many have adopted the 2022 version that came out a couple of years ago. And it looks like maybe a quarter of the states will have adopted it by within the next coming months. But then there are other states, and South Dakota is the most glaring example, where they adopted the food code in 1995 and they haven't updated it since then. So issues, practices, efforts under the modern food code, South Dakota does not follow it. They follow the 1995 version, which makes it a little bit incongruent with what's going on out there. Next slide, please. Cottage food parameters. Originally, when I first started looking at this, these laws were really very, very narrow, meaning sellers could only generate a limited amount of gross sales, meaning you had to be less than 50,000 annually in gross sales, 20,000 in gross sales. That the sellers, whenever you sold something, you had to list your name and also the production facility, whether it's your home, whether it's a facility offsite, whether it's a barn, any sort of facility, it's got a list where it was. The seller also had to clearly indicate that this was a food that came from an uninspected kitchen, that this was food that had not been seen any oversight at all from the state or federal government. The final thing was you couldn't sell it, of course, across state lines because that would put it in the realm of the federal government, which means you couldn't sell it on the internet. Because if you posted anything on the internet, that means you were able to sell it across state lines. So all those things were forbidden. The final thing that was really kind of a unspecified rule with all these cottage food laws is you couldn't sell meat. You couldn't sell hazardous food. So like you're seeing here, buckets of chicken, you couldn't do that. You can do that now in Wyoming. Next slide, please. So food freedom laws out there, these are the foremost ones I want to highlight. California, and the reason I'm highlighting that is even a state as considered liberal as California has adopted a food freedom provision called microenterprise home kitchens. What this does is allows the county to say, kitchens in our county, you can use your home to produce this product, to make food for sale. It doesn't have to be inspected. It doesn't have to be identified as a clean kitchen, which means, if you got pets running across the counter, if you got kids that sneeze into your pots, if you're sick yourself, all these things, hand washing, pot washing, all these things that are required for a commercial kitchen, you don't have to do that any longer in California if the county agrees to that. Not every county has agreed to it. From that, you also have what's going on in Maine. Now, Maine has adopted an amendment to their constitution that says we shall allow food sovereignty. Well, what does that mean? That's a very difficult term to come to grips with because no other state uses the term food sovereignty, but they do in Maine. And what that has allowed is for people to go down, retailers to go down to the seashore, to the docks, buy shellfish, fish of other sorts, lobster, etc., oysters, and resell them right there. So they can either sell it directly to consumers or sell it to retailers who will go back and they'll serve them in the kitchen, which are in the restaurant without any oversight, without any looking at getting anything further. What was so interesting about the Maine law was it was promoted by the Democratic Speaker of the House and the Democratic Majority Leader. It was Governor Le Pen. Remember, Governor Le Pen was one of the foremost Tea Party advocates, hated all federal government, all regulations, hated the federal government. We are a Tea Party. We're going to, pull back on everything. He was the one who said, wait a second, I'm going to veto this. And and pulled it back and said, we can't do this. Federal government won't allow it. So he said, the Tea Party man said it was too far, but it was the Democrats who actually got it passed, and they overrode his veto. Montana, they have some laws, what they call Local Food Choice Act, which allows for local foods in certain local areas or, locally grown foods. They have limitations on what the state can inspect or not. And for the most part, county government can't do anything about it. They want to sell it, they can sell it. North Dakota, Utah, and Oklahoma, and New Mexico, and finally Wyoming. Those are the ones that have really done the most progressive or the most permissive food safety laws out there, or I mean, food freedom laws out there. North Dakota, they allow for raw milk. They allow for sales of a very high level of sales. In Utah, they have made dramatic amendments that allow people in local communities to sell products without very little, if no, regulatory oversight. And if the state or the county comes in and tries to regulate them, these people can sue the county for what for the regulatory oversight for the protections they're trying to do. Wyoming, up to 1,000 head of chickens can be sold without any sort of regulatory oversight. Several meat products can be sold. Different kind of manufactured foods can be sold. Vegetables of all sorts, they can be sold. It has really expanded it greatly up there. So it's been it's probably been Wyoming's probably been the most permissive of all the states that are out there. And what has that led to? Well, next slide, please. According to NORS, they can identify that there has been several outbreaks directly related to foods being prepared in private homes. Over 1,200 reported foodborne illnesses, 22,000 illnesses, 2,700 hospitalizations, 89 deaths. This is what they know over the 10 years that they've been able to track them. They haven't been able to be real specific, because when you look at what CDC has said in the past, is that they've always come up with their 3,000 hospitalizations and X number, or 100,000 hospitalizations, 3,000 deaths, and et cetera, et cetera. That was all based on data back in 2005, before the cottage food movement took off. So this is all data that was, didn't reflect what was happening in cottage foods. Here, the NORS system says, yeah, we're seeing problems out there. They have research, they've had studies that say, if you have an uninspected kitchen, you're going to have problems there. That's where the foodborne outbreaks are going to occur. The best I was able to get from the Department of Health in Wyoming was anecdotal information, which they had conveyed to a newspaper up there. But they're saying, even though food freedom only accounts for like 5% of all food sales in the state, it accounts for 50% of the foodborne outbreaks. If you're going to have a foodborne outbreak, it's primarily going to be coming from a food freedom or a micro or an uninspected kitchen. That's where your problems occur. Next slide, please. Now, when it comes to home kitchens, which is micro enterprise kitchens, anybody who wants to prepare a food product for sale and retail sale, that's what we're talking about. If you make it in your kitchen, the food code explicitly states that food prepared in a private home may not be used or offered for human consumption in a food establishment. Meaning, if you're producing something in a kitchen, you can't resell it out there. You're making tamales in your kitchen, you're not allowed to resell it. You're making cookies. cakes, pies, anything like that, you're not allowed to resell it out there. You're making salsas in you're not allowed under the food code. And that's the current food code. What they're really trying to focus on is the hazardous foods, the meats, the hazardous vegetables and fruits, the time and temperature control for foods. When you got a cupcake, got a cookie, it's cooked to the proper temperature, you're really not going to have a problem with that. There are even certain types of meat you won't have a problem with if it's properly prepared. But for the more, honestly, the more nutritious, the less processed food, that's where you get your problems. It's the raw fruits and vegetables. It's the undercooked meats. It's the raw milk. That's where you have your problem, which means for the states, they're really not trying to push back on allowing people to sell their product or allowing manufacturers to come up, entrepreneurs to come up with a new way of selling their product. They're very much against products that are going to be hazardous. I have been told that this is very adverse to certain ethnic types of foods, certain foods that are prepared in different culture, Muslim culture, Southeastern Asian cultures, Latin American cultures, that this is very much, these regulations are very much against them. People have complained that we are not allowed to sell these tortillas, tamales, burritos out of our carts because the food code is adverse to Latin American cooking cultures. That's not what the food code has been designed for, but they want to make sure of time and temperature control. Food code is designed to make foods healthy. Next slide, please. Now, this is a group out there, the Institute for Justice. They are a Koch brothers funded institution. They are promoting the homemade food movement, the food freedom movement. I've gotten crosswise with them. I have had to been sat down by them and have been re-educated. If you remember communist re-education camps, I have been re-educated by the Institute for Justice. They are really promoting, saying these food regulations are just adverse to entrepreneurs trying to sell their product. What they have listed out here, and this is their information, is in the light yellow states, those are the most permissive states. You get to dark yellow, they're better, but they're not as permissive as the light yellow states. When you start getting to the turquoise and then the dark turquoise, those are the ones that have the strongest regulations on the books that and are most protective and least permissive out there. And you can see interesting that Georgia is among that. Well, the reason Georgia is among that is because the Commissioner of Agriculture is elected, and he has made no bars about it. He is not going to really allow retailers to be selling foods that have not been inspected. And other states are along that line. But as we said, it's a real mix here. We're not seeing only red states adopt this or only blue states not adopt it. It is very popular among all state legislatures. Next line out there. What I wanted to kind of highlight here is these are bills that have already been introduced in the 2025 legislative session. And each one of them is trying to hit on something different. I'm going to highlight just a few of them. Colorado, even though it has a Democratic House, a Democratic Senate, and a Democratic governor, is very, very pro food freedom. And the governor of all people was the first in the state. He was very much proactive on being able to sell meats that have not been regulated, meats that come straight off the ranch and can be sold directly to folks. The Department of Health has been able to convince him to say, you need to make sure that certain foods out there need refrigeration. You can't just sell it directly. He has agreed to that. They're moving forward with House Bill 1190. Um, Illinois, they're coming forward with a food freedom truck. The mobile food units that you see out there, they're trying to put a law out there that's going to allow them to get a permit to sell unregulated food. That could be interesting what's going on. The one I really want to highlight is Indiana House Bill 1562. This is going back the other way. It is a law that says, we're having some problems out here. We're having foodborne outbreaks occur. So this one provides that a small farm or home-based vendor must complete and pass food safety training. That is something I've seen other states do, most notably Texas. Texas did something incredibly intelligent. The legislature down there, they passed a bill that said, if you want to sell unregulated food at a retail level, you at least need to get trained. If you get that training from the state, you have an affirmative defense if you are sued. That's a perfect way. That was a very smart way to get these micro food, these home-based vendors to start getting training, at least learning what they're trying to do. Next slide, please. I'm just going through these very quick. New Hampshire has a whole series of bills out there trying to allow what they call homestead food production. And they're coming up with a whole new series of what would be allowed. Freeze-dried food, dehydrated meats. These are things that are going to be allowed in what they call the homestead food production. Oregon has an interesting one here where it requires HOAs, homeowners associations, requires them to allow people to grow gardens, raise hens, bees, anything like that for within their community. Tennessee would allow to expand theirs to allow the sale of dairy, meat, and poultry. So this is constantly expanding out there. Yesterday, I was in Austin talking with the chair of the Senate Health Committee. She wants to get expand cottage food operations. And it's not because she doesn't think there's a health risk. She does. It's just that she wants to make sure that the state's not being prohibitive, that it's not stopping these small businesses from gaining an entry and selling their product. Let's figure out a way to do it safe. We worked with them. I think the bill that's going to come forward is going to be something we can work with. Next slide here, micro enterprise kitchens. This is also a very popular issue. Even in New York, they're taking a look. They want to study what they call kitchen incubators. That's going to be home-based vendors, people producing product out of their own kitchen for sale. So it is a very popular item among state legislatures from both sides of the aisle. With that, I'm going to turn it over to my final slide. And back to you, Nina.
Or Catherine, or maybe me.
Or Catherine, or Kathy.
Yes, next we're gonna have Kathy Hoke, the Director of Network for Public Health Law, Eastern Region, present.
Thank you, Catherine, and thank you, Doug. I am always educated when I talk to Doug about these food issues. It did make me hungry, so sorry that we're having this midday for most folks. Time zone on some level, it's lunchtime, but all the reference to cookies and cupcakes was a bit much there, Doug, but I appreciate it. So I am going to shift us. Food safety does, play a role in obviously the cottage food stuff, and it does play a role in what I'm about to talk about. It's kind of tangential to my focus here, but I know the issues do come up, so I'll touch on that food safety aspects a little bit here. I do want to give a shout out, and I am, completely apologetic for not including it on this first slide, and I should have, but the work that I'm presenting really is drawn from work of 3 students. I also teach at the University of Maryland Carey School of Law, as you can see on this slide, and I teach a public health law clinic. And my law students do great work over the course of each spring semester in law and policy work in the public health space. And last year, some of the documents I'll reference later in this presentation were created by the students and really is the foundation for this presentation. So those are 3 2024 graduates of Maryland Carey Law School: Alex Sedzkowicz, who is actually getting her MPH now at Emory. So she's not out there practicing yet. And Michael Heffron, who graduated, and Brian Choi, who graduated. So thank you to Alex, Michael, and Brian for really putting a lot of energy and effort into the work that undergirds this presentation today. So next slide. Thank you, Catherine. So I'm going to talk about two slides on some facts, right? This, my discussion is really the intersection of food waste and food insecurity, because they are super interconnected, and any work that we can do to bridge the gap between them is going to improve food security and reduce food waste. I don't have any information about that on this on this slide about the environmental impact of food waste, just because that really isn't the focus here. But the policy brief that the students prepared that I'll reference later, and there's a lot of research in the space of, food production, the process of food production itself is in some respects an environmental hazard, a necessary one, right? The benefits of food production are tremendous. We can eat. We get the food that we need to eat, but there are obvious environmental impacts of that. And so the goal from an environmental perspective, and I don't need to tell Doug this with, NEHA, but and his previous work in environmental context as well, but that, we want to reduce the harm to the environment. And so if we're having food waste, we have excess harm to the environment that isn't translating into benefit on people's tables. And so the goal here is to really diminish the environmental impact as well. But from a food waste perspective, we know that over the lifespan of food production, whether it's dropping a seed into a ground or any of the ultra processed foods that are created in a lab or manufacturing facility, from the beginning of that until the end of its life, about 30 to 40% of that food that is produced is wasted. So just let that sink in with you. More than a third doesn't get actually into bellies. And so where is that happening in the chain? So you can see the data breakdown here. A large chunk of that is coming from the retail and food service, meaning essentially restaurant, right? So retail meaning grocery stores, convenience stores that sell food products, big box retailers that sell food products, and then food service, whether that's full-on restaurants or, small takeouts or the like. That's the largest chunk of this 66 million. The data point does include residential sectors, meaning our homes, in there, but we know that's the smallest portion of the 66 million tons of food. I don't say that to discourage you from being mindful about food waste in your home. My family here is kind of sick of me talking about food waste, but there are champions of eating leftovers, and I'm really proud of that, because you can make a difference in your community and in your home by reducing your own and creating a culture in your family of reducing your food waste. But let's be clear, it's really the retail environment, the restaurant environment, where the big chunk of this food waste is occurring. Food that is particularly prepared food discarded at the end of the night, perishable food that doesn't get used or just isn't aesthetically pleasing, and so doesn't actually even make it to the shelves. Then there's 40 million that's lost before it even gets to that space, right? So whether it's through the agricultural process or the manufacturing process, food that doesn't even make it to the retail shelves or to the restaurants for preparation. A lot of, there's also the beverage data in there. A lot of that is actually for aesthetic reasons, right? We know that from a produce perspective, produce is discarded because people like their apples to look perfectly round and red or yellow or whatever color that particular strain of apple should be, when that doesn't actually impact its nutritional value or its taste. But we as as a society are looking for those beautiful looking fresh fruits and vegetables. But there is also waste in prepared foods that just don't make it out for any number of reasons. So there are lots of places in the food process where the waste actually occurs. And just to drive home the point here, $218 billion of waste and 130 billion meals that could be on people's plates annually. that this waste represents in the United States. So next slide. That situates us into the food security aspect of this and why these are interconnected. Most folks on this call are probably keenly aware of most of this data, or at least recognize and acknowledge that we have a food insecurity problem in our country. I dare say with food prices not going down and seemingly potentially going up, it's only going to get worse. And with Congress considering cuts to social network programs or support programs, we may see these numbers tick up from food insecurity. Even in our really good times economically in this country, food insecurity is a crisis. And so it's something we need to keep our eye on at all times. Access to sufficient, nutritious, and healthy food is a social determinant of health that impacts us all across our lifespan, and at work and at play and at whether we can attain our education, et cetera. So it's one of the critical factors that contributes to health. I just wanted to put some data out there to show you who is impacted by this. You can see nationally, 13.5% of households in the United States meet the definition of being food insecure, and that's 47 plus million people. So keep that 13.5% number in your mind when we now look at who is actually very acutely affected. From a racial health equity perspective, this is an acute problem, with Black and Hispanic households having food insecurity rates at 23 and nearly 22%, so much above the national average. Interestingly, and I love to put this data point in here, people living in urban and rural areas have the higher numbers than the average number as compared to people living in the suburbs. And it is, I would hope one of those issues that, we can coalesce between the urban and rural communities that often don't have the same issues. They don't experience some of the same issues, but in food insecurity, those rates are almost equivalent in rural and urban as compared to suburban. And then again, to drive home the point is who demographically is affected, women. So women living alone experience food insecurity at much higher than the national average. But look at that second point there on the women line. Single female head of household, meaning single moms basically, have food insecurity rates at nearly 1/3, or more than 1/3, 34.7%. So that is having obviously a disproportionate impact on women, but also on children. We can, blend that in. So it's no surprise that also is drawn from and impacted by the fact that 1 in 5 pregnant people lives in a food insecure environment. And so blending together the fact that there are millions and millions of meals that don't make it to people's tables, dollars lost, what are the legal levers that the federal government and state governments have put in place to try to incentivize, avoid that waste and incentivize getting the unwanted food that is still, safe for consumption onto plates. Next slide. The first thing I'm going to talk about, I have 2 slides on this, so it won't be long, but on the Bill Emerson Food Donation Good Samaritan Act. Most folks know what Good Samaritan means, but it's when we act to the benefit of someone else when we're not legally compelled to do so. And by and large across the country, when we talk about Good Samaritan laws, these are laws that protect that person who steps in to do something philanthropic, something generous, and alleviates them from some liability in that space. And so here in the Bill Emerson Act, it relates to food donation. I'll talk about who it applies to on the next slide, but essentially actors who are covered under the Bill Emerson Act are protected from civil and criminal liability associated with distributing, usually for free, but there's kind of an exception to that as well, in good faith. Right. So they can't be acting with gross negligence or intentionally, misconduct of sending bad food out, unsafe or unhealthy food out. But as long as they act within the confines of this good faith standard in donating food, they won't face liability if there does happen to be a foodborne illness or other kind of related outbreak associated with the food. So that's kind of the general. Next slide. The more specific is who's covered. So pretty much everyone, right? So I put on here farmers and gleaners, but really pretty much every person is covered in this distribution process. But I wanted to define farmer and gleaner. So this applies to retailers, to grocers, to wholesalers, hotels, right? Manufacturers, restaurants, caterers, farmers, nonprofit food distributors. So it applies broadly. It's really there's been a lot of work done in the farmer space, which is why I wanted to highlight that here. So farmers and gleaners, I'll define in a second, are explicitly covered and have been really targeted as, interested parties. They want their food to be put to good use if it can't be used, if they're not able to sell it for distribution otherwise. So they do seem to be really interested in making that happen, and having some protection for them can make the difference. Gleaners are actually, by definition, folks who come in from nonprofit and community-based organizations who come onto a farm that maybe there has been a harvest, and there's always produce left behind in a harvest, either because the machinery or the staff who are doing the actual harvesting naturally leave stuff behind, but also that there is product that is considered, again, not aesthetically pleasing and may not be eligible for sale through the farmer's contracts with whomever they're selling it to. Maybe the apples are too small, but they're still tasty, they're still good for you. And so a gleaner comes in and actually collects all of that. The farmer doesn't have, the costs associated with gathering that, and they open their space to the gleaners to come in and do that. So gleaners also are covered by the Good Samaritan protections here. The Good Samaritan protections apply in the federal law to apparently wholesome food. That's the language used in the federal code. There's actually different language used in some of the state statutes that I'll reference later, but apparently wholesome food, and I'm going to actually just read the definition instead of trying to remember it, but it's all food and grocery products meeting quality and labeling standards set by federal, state, and local laws, even if the food is not marketable because of appearance, age, freshness, grade, size, or other conditions, essentially the aesthetics, right? So it does talk about the food meeting requirements of federal and state law. And we'll see a little bit of a difference in the definition of kind of covered foods in some of the state provisions. They're also new in 2023. This really came, many states had already adopted provisions in their codes like this, but the federal law included a provision that explicitly extends the liability protections to nonprofit organizations who actually distribute the donated food, so that the farmer, the processor, et cetera, they enjoy that, but also so does the nonprofit who comes and gathers the food and has a food distribution system that they use to get it out to the community. And then the food has to be free, or again, a more modern change is the Good Samaritan reduced price. The Good Samaritan price includes essentially just the cost of production of the food and harvesting it and getting it to where it needs to go to be either delivered to individuals or to a food bank or the like. And so a farmer can actually recoup that cost. And a nonprofit organization might pay that reduced cost to get that food to provide to the community. There are also what we call social supermarkets, where again, a food producer might be providing perishable or non-perishable foods to one of these social supermarkets at that Good Samaritan price. So the producer hasn't lost any money, the farmer hasn't lost any money, but the product is being sold with no markup, right? And so, but those grocery stores are often so people do pay a modest sum at those, what we call a social supermarket. Folks who may not qualify for SNAP benefits or want to go to a food place where the food is free. There are people who, for their own personal perspective, there maybe a dignity aspect for them, want to be able to pay the bit that they can pay. And so there was an adjustment so that that part can happen too, that there can be a modest amount of money associated with getting the food into the stores and selling the food at that rate to the community. So the important thing to take away here too is, because I'm about to talk about state law, that the federal law sets a floor. Very often federal law preempts states from doing more in a space. Here it's kind of the opposite. The feds are saying, this is at least the law everywhere, but states can and they have done more. Next slide. This is going to be first about federal tax incentives. Sorry, I forgot I put them in this order. But there's another legal lever that's used. I'll talk a little bit less about that, but I just want to point it out, and it is in the materials that the students prepared for us. And that is that there are, I am not a tax person, and I know the second I start talking numbers, people's eyes roll to the back of their heads, but there is in the federal tax scheme a deduction for donated food. And then there is actually an enhanced deduction for donated food that you can see kind of defined here. So there's a ratcheting up of a higher level of deduction that that farmers or others who produce food can have. It's really based, there are limits. And so major corporations are not getting a huge tax deduction for this because it is limited in some respects, but it's also based on the taxable income. But it is an incentive. It is another legal lever that we use to say to food producers, food suppliers, farmers, hey, if you have this excess food, not only can you donate it free of liability, but you can get a tax benefit for it, again, with these calculations. On our materials that I will link to in the chat after I'm finished talking, there is a document that really talks nicely through this if you're interested in more deeper information about the federal tax scheme. Next slide. Now we're on to the state laws. So this is the link to the front page of our 50-state survey that I mentioned Alex, Michael, and Brian did for the network last year. I encourage you, if you want to know where your state is on state law, on food donation and tax incentives, pop up this chart. Again, I'll put the links in the chat in a second. You can easily find it on our website as well. It's effective as of last year. We didn't do an update from the new legislative session or from the 2024 session. And so we'll probably be updating this in the next 6 to 8 months or so. But you can click on your state. You can click on other states maybe around you, say who's doing better than us? Where's our law stand as compared to other laws to see whether there are any kind of enhancements that you might want to encourage to see if that will help food donation in your communities. Next slide. I just want to give you a couple of examples of what you might see out there on a state-by-state basis. So first, again, states, the baseline is the federal bill Emerson Act, but states can and have done a lot more. And again, some of that feeds back into Emerson being updated over time as states are more the laboratory of innovation here. But I pulled out a couple of examples. You'll see first, California and Oregon. And this kind of relates back to that when I told you the definition of apparently wholesome food under Bill Emerson and that it has to meet federal, state, and local kind of regulations. Well, California and Oregon in their food donation statutes actually allow for donated food to be subject to the immunity protections, even if it doesn't comply with certain laws and rules or kind of ordinances on packaging or labeling. And so there may be foods that are produced by a manufacturer that don't meet maybe a federal nutrition labeling requirement, right, under the NLEA, the National Labeling Education Act, right? That's what that stands for. So foods that don't have that, but nevertheless are wholesome, are safe for consumption. And so they give a little wiggle room in California and Oregon with respect to that packaging and labeling aspect of, kind of other legal requirements. Massachusetts, interestingly, and there's a lot of work being done in this space from a food safety perspective, but Massachusetts liability protections extend. You still are subject to that kind of good faith of that, thinking this is wholesome food, that this is safe food for human consumption. But merely because the product is past its expiration date, which is a whole nother webinar about what expirations date even mean when it comes to food. I see Doug nodding along because there's no easy answer to that question. But that limitation itself won't, in Massachusetts, limit the liability protections. And so it can be past an expiration date. Again, the donator does have to be acting in good faith. If you know you have a highly perishable food and it's past an expiration date in a significant way so that, the milk has gone bad, the cream has gone bad, or what have you, you're not going to have that protection. But just having it past the expiration date isn't itself a reason that you would lose your liability protections under the Massachusetts statute. Maryland, my home state, of course, was going to get mentioned in here. And Doug did mention a pending cottage food bill that we're tracking in Maryland as well. But Maryland offers, again, similar to California and Oregon, just a bit of an expansion of the food that is covered for your immunity protections. And you can see here it is kind of regardless of the condition, nature, age, or packaging of the food, as long as that food was donated to a nonprofit in good faith. So it's really looking back and giving the producers of the food or the farmers some discretion and expertise in, knowing whether the food is safe for human consumption and in making those contributions so that they're not stuck to the rigid confines of the more rigorous wholesome foods definition that's in the Bill Emerson Act. Next slide. States also differ in the tax incentive setups that they have for food donation. And so again, I don't want people's eyes to roll in the back of their head with numbers, but California provides, and this is an interesting one, why I pulled it out, is a tax credit for the transportation cost of those donated crops, right? Up to 50% of the total contribution. So what California was experiencing, and other states as well, for sure, that one of the costs associated with donating food for the farmer, if they don't have gleaners who can come in, right? Nonprofit organizations can't get out to all of the areas where the food might be gleaned, that they can get a tax credit for transporting that product that they're not able to sell on their contracts or farmers markets or what have you, and they want to be able to donate that food to be used, in their communities, but there is a transportation cost. And so to help the farmer and incentivize the farmer from bringing that food to the people, they allow for a tax credit for transporting those donated crops. So that's, I think, an easy add to lots of the state provisions, particularly where you have farmers who are in more rural settings, right? And they can provide the food within their rural settings, but there could be increased demand in urban settings that are maybe farther away and require that transportation cost. Pennsylvania has the charitable food program that also has increased their tax, has a higher tax credit for donors if they're approved under this program, and it can be up to 55% of the total contribution. So again, I'm not offering any tax advice, but if you're in Pennsylvania, you can look at what the provisions are there and entering into their charitable food program. And again, my local prejudice of pointing out Maryland's, because we passed this in 2023. Lots of provisions are in this act, the Farmers Feeding Families Act, but one really ratcheted up the amount of tax credit that farmers in Maryland can receive for donating food. There's a complicated, or for me as a non-math person, perhaps a more complicated calculation. I give you kind of the basic description here that they can claim 100% of the wholesale credit. Most of the limit is $5,000, but there are exceptions that can take you up to $10,000. And the Maryland Department of Agriculture uses data from the USDA, at least data that we used to get regularly from the USDA, which I actually don't know whether it's going to be regularly provided now, and data from the Maryland wholesale market to establish what those credit numbers are, what the wholesale credit numbers are. So there is a state agency that has the obligation to support farmers. Farmers aren't having to make up these numbers. There is a state agency that is doing that. Next slide. Before I get to the innovations, I do just want to mention that, like I said, there are food safety issues, right, included here. I've worked with some local food donation facilities here in Maryland who, even with the Good Samaritan protections that we have and the tax incentives, they have genuine concern that they would never want, their food that they donate to cause someone to become ill. And they feel they have less control when they're donating it than when they're, they sell it to another vendor who then sells it to the individual. They're free of that liability because the vendor is now the one who holds that liability. And so I'm working locally to try work through some of those food safety issues. So I just want to mention that I do recognize that even with the liability protections and the tax incentives, there is this just undercurrent of what is the interplay between a state's or county's food safety laws and donating food. I will recognize too that, at the federal level now, the federal government doesn't engage in kind of active regulation of food safety at the kind of consumer level. But we did see the resignation of what I call the food safety czar from the FDA as a result in changes under this administration. And so, you know, we are in this kind of shifting sands of what the federal regulatory space is going to look like here. Probably most acutely the intersection of, because the Department of Agriculture actually has lots of role here as well as the FDA. And so the intersection of those agencies and whether and how they continue with their kind of food safety regulatory schemes is, I think, a up in the air question. I think that just says that states and locals have to amp up and stay true to their obligations to keep their communities safe when it comes to food safety. So I don't think we're without measures to be able to take care of this. So I wanted to end with a slide that talks about some innovations and then crowdsource any others that you have that we can talk through in the Q&A or in the chat or offline if you want to email me any. But these are some things that I've learned about in the food kind of security space that is also about reducing food waste. At my campus, UMB is short for University of Maryland, Baltimore, that is in downtown Baltimore, all the professional schools for the University of Maryland, medical, dental, social work, nursing, etc., the law school. We're all here on the University of Maryland, Baltimore campus. We started a program where students can sign up for this app or just a notice, I think, that comes to their email. Anytime on our campus where there's leftover food from an event, students get notice of that, where it is, how long it's going to be out, and basically what it is. And if you think about on a campus of our size, how many events that there are on campus and how much excess food there is, and don't for any minute think that graduate students aren't food insecure. They very much can be, living off of student loan debt and the like. So this is, to me, an easy peasy, right? Institutionally, where are you working? Can your institution do something like this to serve the community, and knowing that you might have some liability protections if you actually invite people or distribute that food out to individuals. There are also apps. The great thing about working at the law school is I encounter young people all the time who teach me things. There are apps. They are for profit. This is not about food donation as such, but or say, for example, a restaurant has a chicken platter that they were selling that day. They close at 9, and at 8 they realize they're definitely not going to sell all of their half chicken with mashed potatoes or what have you. And so they put it out on this app. Instead of the $15 you were going to pay for it, it's $5. And so food insecure people, again, particularly young people, maybe students or people starting out are probably the ones using these apps, can go ahead and get maybe they're getting their dinner at 8:39. That's probably when they're eating anyway. And but they get it for $5 instead of $15. And so instead of that food being wasted, it gets into onto somebody's table and into somebody's belly, but at a cost that is palatable to the person who wanted or needed that food. So that's an innovation. And then there are just these other two that are about in our own practices. We host a lot of events on our campus. I run another organization called the Legal Resource Center for Public Health Policy, and we have small, mid, and large gatherings around the state and locally where we have to do food ordering. We've been really good about being mindful that we order not too much food. I have the problem of never wanting to run out of food. So I do, you never want to run out of food, right? Your reviews, no matter how great the substance of your event is, will go down if people are not satisfied with the food. But being mindful of your purchasing and thinking about mindful purchasing so that if there is food left, it's food that can actually be easily distributed into the community if possible. So for us at our smaller and mid-size events, we've switched to box lunches. And if there are, half a dozen box lunches left at the end of the event, I can bring them back to the law school and put notice out to the students, or I personally take a route home from the office that takes me past a couple of corners where I know where I'm going to find folks who are happy to take that food. But if it's in a package and it's, an apple and a sandwich wrapped in a bag of chips, that's just a little bit easier to distribute than if you have buffet food. So just thinking through that. We also, and Catherine probably knows that this is true, if we're hosting an event where we're doing buffet food, I encourage the team to say, hey, bring in your disposable or reusable containers. If it's disposable, I again might be giving them out to folks as I'm driving my way out of the city, or my team will take the food home. And I'd much rather that it went on their table and into their bellies at their houses, or they could take it to an elderly neighbor or a family member who might be in need, instead of it going to waste. So just the little things, you know, there are legal levers that are encouraging the people who are making all the money in this space to do the right thing, but we can also do the right thing at our organizations and in our homes. So would love to hear more about innovations. Last slide, Catherine, from me. This is just some links. I'm actually going to pop into the chat also. Actually, oh, the link, some of the links are all on here. I forgot that I made this slide. So there's a link to the Bill Emerson Act itself. Then the Harvard fact sheet is the one I told you. It really walks you through some of the liability protections there really nicely. And then the tax deduction one from Harvard is really helpful. And then the last two are our network products that I mentioned that Alex, Michael, and Brian produced for us last year. So I think there's a closeout slide, Catherine. I should turn it to you. Or we can look at the Q&A box because I know there's in there.
Yes.
I wasn't able to look at them while I was talking.
Yes, I can definitely start addressing some of the questions. And of course, if you have more questions, I can try to get to them. Just put them in the chat as anyone has them. So the first question I want to take is for Doug. During your presentation, someone asked how you respond to concerns about recent food outbreaks from big companies. This question listed Trader Joe's, Costco, etc. And another question related was asking about emergency food recalls for highly regulated food production spaces, how that affects the cottage foods market.
Well, they're both kind of separate in their own way. Meaning from the big industries to the small. You go the other way around, the small industries have a huge impact on what big industries do. The cantaloupes at Jensen Farms, which was a small operation in southeastern Colorado, forced the produce industry and specifically Western growers invested millions into getting people to eat cantaloupes again. When we had a situation with Peanut Corporation of America, no one ate peanuts. The industry dropped by 10%. So it has a huge impact. These cottage food operations actually have a huge impact on the big guys. The big guys don't really have much of an impact on the small, because when you have a problem at Jack in the Box, when you have a problem at Boar's Head Food, when you have a problem at Trader Joe's, it affects Trader Joe's. But when you have something that happens at some of these small farms, when you have an outbreak from raw milk, nobody drinks milk. Doesn't matter if it's pasteurized or not. Nobody drinks it. So I think the pressure goes from the cottage foods onto the big manufacturers rather than the other way around.
Thank you, Doug. The next question I have is for Kathy. Someone was asking, how can you verify that food at food pantries other than canned food has been screened and from a regulated source, and where you can check with your state for regulations on food safety?
Yeah, sure. So two good questions that I think actually a little bit relate to another question that's in there. So maybe I'll loop that in at the end. So because the liability, remember, the liability protection only extends to donations made or sales or distribution. So it includes the donation process, but also then the contribution to the community process. So that all of that has to be done in good faith, and that doesn't protect gross negligence or intentional misconduct. And there's a question here about what gross negligence means. So let me just answer that in part of answering this question. Every state has probably a case that defines gross negligence, but by and large, what it means is kind of reckless disregard for whether this food is safe. And so the factual scenario asked in this question of if a restaurant has prepared a food item that they've held beyond the allowable 7-day time frame and knowingly donate that, is that gross negligence? No. mere violation of it may be under the state code not covered by definition, because it's not wholesome food, because it violates a state statute that's like that intersection between food safety law and the food donation law. But if your food donation law doesn't have that kind of rigid definition of what food can be covered here, that is not gross negligence, because some of that food can be safely consumed. Now, if they have reason to believe that food can't be safely consumed, or reckless about their concern about whether that food can be safely consumed, that's gross negligence. I think intentional is like obviously on the way end of the spectrum, but that gross negligence, it's hard to define. It's you know it when you see it, but it is a pretty high standard. And so it again is that reckless disregard. So that's again that interplay, and I'm not surprised these questions come up because it's what keeps coming up for us as well. The state law says we can donate this food, but what of the food safety laws apply here? And that is a next level kind of analysis that the network's going to start engaging in. And then finding your own state's food safety laws. I'm actually going to ask Doug, do you know, is there a good, I just know how I would look in a particular state. I don't know if you're in a state and you want to know more about your own food safety laws, reach out to the network. We provide free, quick TA. We can connect you with what your food safety laws are. But I don't know is there a good repository, Doug, or source for that?
Yeah, it's something the network really should take on. But there
in my free time, Doug.
There are repositories out there. We have a good sense about what's going on retail food, especially the food code. AFTO has a good one on manufactured food, which is a different animal than retail. But they have a good sense on that. But you're absolutely right, is that every state has their own law. And I'll share with you my list, and I'm just trying to figure if I can do it quickly here, and probably not, but I will share it with you.
Thank you both. One more question.
So many questions are popping in, Catherine.
I know. One more question for Doug. Do some of those food freedom laws have labeling requirements?
Yeah, almost all of them do. And really one of the core issues is like, if you produce this, you've got to tell people it's been produced in an unregulated kitchen, and you got to tell them where the kitchen is. But on top of that, though, you get caveats, meaning, some of these producers, it's at their personal home. They don't want people to come to their personal home, so they don't want to put it on there. Well, so you get a PO box. Doesn't really, help you if you got a situation there. Really, when you do this, the state, the local governments need to know where this food is coming from and where you're producing it. So if we have an outbreak, they can go back, but the laws aren't really written to allow that. It does provide for a lot of exemptions. I'm going to end on my favorite bill that has never been passed. It was a labeling law out of Montana regarding raw milk. And it said, anytime you sold raw milk, you had to put a poster up there that was 2 feet by 3 feet that said, raw milk will kill you, according to the CDC. Or and it was one of those things that was never going to pass, but it was just a wonderful statement about saying on how dangerous raw milk is and what the retailers should really be telling the consumers about the dangers of raw milk.
Doug. Kathy, do we have time for more questions? Okay, great.
Yep, I think we were till 2:15, so we have 13, or I think you need to leave 2 minutes at the end for announcements, but yes.
Yeah, great. Okay, so I'll stick with you, Doug, for a moment here. Someone was asking about scale appropriate legislation, if that's a good way to look at food freedom and kind of scaling legislation based on whether you're looking at a big manufacturer or a cottage food.
Yeah, that's where the food freedom gets very dicey, because when you start talking about a cottage foods, you can't make any more than 50,000 in gross sales. 100,000, they're going to raise it to 100,000 in Texas. Some go up to 200,000, but there are some that don't have limits on there, and that's the food freedom. And we're getting to a situation where you could go into Whole Foods, and the reason I'm picking on Whole Foods is because they're based in Texas. You can go into Whole Foods and you'll be able to buy a product, and somewhere on the label it'll say this was not inspected, you know, little thing. And it's going to be able to go out the door. And Whole Foods is taking a heck of a liability by selling this product, but it's getting to the situation where it's getting tougher and tougher for retailers to say, wait, I'm not going to sell a uninspected food item, because it's becoming more and more prevalent and getting ingrained more and more into the retail food system. So, there are big companies, Cisco and etc., that sell food, and you go and these retailers buy food from them. And it's kind of like a quiet assumption that these foods are safe and that they've been inspected and that we have oversight, and that protection is weakening continually. Every year it gets a little bit weaker. So we will have a situation, I'm confident, where we will have somebody buying products from one of the big retailers, and it's going to lead to several foodborne illnesses that are going to cost them dearly. And the numbers that come back, I mean, you say you're in the legal profession, how severe these cases can be to a major food producer. See what McDonald's with the E. coli outbreak, how it affected their bottom line in the last quarter. Severe.
Thank you, Doug. Kathy, I think, a question for you about the best before date or sell by date. I believe this question is about the Massachusetts law you were talking about, where the law covered expired food, and I think that's what this question is asking.
Yeah, so I'm actually not sure of the answer on the Massachusetts, because I summarized it as expiration date, so I'd have to pull up the statute. And whoever's asking that question, if you want to reach out to me, I'll take a closer look. But remember, part of the problem here is that we think that there's regulation of those dates that are on food that are super clear, that, oh, okay, here's the standard, here's what that means, best by, sell by, et cetera. But there's really not. And so I think the Massachusetts law is actually a reflection of that, recognizing that, I'm trying to say this in a politically savvy way, that manufacturers actually want there to be expiration dates that maybe are sooner than is necessary from a food safety perspective. Because if you leave that oatmeal in your cabinet and then you look at the bottom of the package and it says, oh, that expired 2 months ago, you're probably going to be okay to eat that oatmeal. But it has, probably decreased in taste. And, yes, there's an increased risk of it not both tasting good, but not being good. So they're more incentivized to have that expiration earlier. From a food safety perspective, we know those dates could probably go a little bit later. And so I think the Massachusetts provision here is kind of reflecting that difference, because there, again, does have to be that good faith that the food is, is wholesome. But I can tease out more about the Massachusetts directly if someone just reaches out to me. So it's not an easy answer. Sorry.
And I'm just going to add to that. These are industry-based standards. These aren't really something that the states or the feds really, for the most part, require. For the manufacturer, they want a short shelf life because they want the retailers to have to throw it away and buy more product. For the retailers, they want a longer shelf life so they can keep it on the shelf longer. And it's a constant battle in the industry about how long these states should go.
Thank you. Doug, are micro kitchens subject to food safety inspections? I believe you hit on this earlier, but I just wanted to answer that person's question.
The short answer is no. That's the reason that they pass these laws, is they are not subject. And some states, some jurisdictions, you can't go in there at all without a warrant, basically, to inspect them. California has a little bit more modifications where they're saying, well, they should be inspected once and then, never again. Others are saying training. We want to at least let them know that certain things you don't want, like I said, don't want cats running across the counter. You don't want kids sneezing into the pots. But really the bottom line is no. That's the reason that they pass these laws, is so they are not inspected.
Thank you. Okay, Kathy, I was wondering if quickly you could go over again for this question. Someone's asking whether you have to follow the state or federal law. Is it the one that's more strict? And I think you can just go over again the floor of the federal law.
For sure. So basically, what really is the case is, the federal law provides this baseline, but most states either have really just adopted the exact same provisions, and so the Emerson Act and the state laws actually are very much the same. So a lot of the same definitions and the same provisions. At least that was true, I would say, up until about a decade ago, when we started to see more movement in the states saying, hey, sorry, because now my dog is bugging, right? Doug, we knew that would happen. The perils of working at home sometime, folks. But most states then started to make changes to try to ratchet up the incentives. Why wasn't more food being donated? Why weren't these policy levers being used? And they identified what kind of aspects of the law needed to change. And so states have, I'm literally sorry, just a second, states have changed their laws to expand the type of people who are protected by the liability, the types of foods that are covered, again, loosening up so that rigid, if it's, has an expiration date, you're not going to be protected, but saying that you are. And so, less worrying about whether everyone's kind of protected by the basic federal standards, but look at your state and see, does it offer more? Because we know the Emerson Act is not really, it's been on the books for a really long time and has done marginally well. But states are really the innovators, adding more, so that more expansive. I mean, the fact that they added gleaners in, because that became a thing, right? That there were nonprofits who were like, well, we'll send the people to your farm to come get that produce. We will harvest it for you. We'll take on that expense and that, hurdle. But if they weren't protected in the process, it was kind of, not as effective a tool. And so laws changed to make that happen, allowing that indirect, the farmer donating to the nonprofit who then processes the food and makes it available, and that everybody's protected in that. So the federal is that floor, but look to see if your state is giving more. I want to actually, somebody else asked about, hey, how do we get people to do this though, particularly big companies? Big companies are the worst. Your big box retailers are probably not responsive to community requests for donating food, right? So I say start smaller. Your smaller places are more likely to want to be engaged in community development. They're less stuck by corporate policies that make doing anything like that a bureaucratic red tape problem. And so start smaller. But I do think educating the community that is protected by these laws and can take advantage of these tax incentives would be a worthy effort for community organizations that want to engage in this process, to get out into the community of affected retailers and grocers and restaurants so they feel more comfortable donating.
Kathy. Kind of a current events question for both of you. Have you noticed any change to consumer purchasing trends of non-regulated foods due to bird flu concerns?
I haven't.
Me neither. I just don't know, right?
Yeah.
I mean, I think what Doug said, the part of the problem is that when we have a foodborne illness outbreak, potentially that's associated with bird flu that came through dairy. It's not just, it's probably going to come through raw milk, but the entire dairy industry will be affected by that, because you're not going to purchase the homogenized milk because you've heard that there's a milk-borne foodborne illness outbreak. And so there's incentive, I think, for the non-raw milk producers to want to protect folks against the more likely to be infected. I know there's a ton of questions in the Q&A and stuff in the chat that we're not going to get to, but I'm going to turn it back over. Catherine, I don't know if you close out or if Nina's going to talk about the conference before we depart.
Yep, I can close out real quick. The slide about our conference has been up while we've been answering questions as well, so definitely check that out if you're interested. So I'd like to just thank Doug and Kathy real quick for the great presentation, and all of our attendees for the great questions. And just a reminder that you'll receive an email once the materials have been posted, and it will have a recording of the webinar and the slides for you. So thank you, everyone, and have a good rest of your day.
Thank you.
Thank you, everyone.